Hi, everybody. This is Jim Prusak, physical therapist and owner of the Pain PT. And today we're going to talk about one of the categories when we're talking about the brain and nervous system and chronic pain, and this is our thoughts, our thinking. We're going to talk about how negative thinking really affects chronic pain and how it's an integral piece of the pain itself, and how when we start to change our thinking, we start to change the pain. Now, we know from research that the prefrontal cortex is one of the areas of the brain that's linked with chronic pain. And you can see this in some of my other YouTube videos at the Pain PT. I talk about this area of the brain. The prefrontal cortex is our executive center of the brain. It allows us to take actions and controls all our thought processes. And really, when we're thinking and when we're negative thinking, which is called catastrophizing, it has an effect on our pain. In fact, studies show that people who catastrophize have a 50% greater chance of developing chronic pain than regular people. And we know that negative thinking just perpetuates and sustains pain as well. So any of these thoughts you see here and many others, if you find yourself thinking this way, you're actually just making your pain worse. We know that negative thinking is a consequence of chronic pain, and it's normal. It's understandable. Nobody wants to feel pain. Nobody wants to be in pain for a long period of time. So what happens is it creates this negative loop where our symptoms create these negative thoughts, and that goes on to create more negative feelings in the body. These negative thoughts, after a while, just pop up from our subconscious mind, right? We don't actually always initiate them ourselves, but we have a connection with our symptoms. Immediately a thought pops in our head. This is terrible, something's wrong. And then our mind takes it and runs with it. We start thinking more conscious negative thoughts. We start thinking for the worst. So what we need to do, we need to ask ourselves this question: do we believe our negative thoughts? Because a lot of times they come so quickly and in reaction to our pain, they just pop up. But once we believe these thoughts, we're hooked, we're caught. We start thinking more negatively, we start piling on more thoughts, and we create a vicious circle that goes around and around. The same old thinking is going to create the same old results. Now, a thought is a real thing. Even though we can't put our hand around it, we can't see it, it's an actual brain reaction. It's an actual electrical signal in the brain that creates a cascade of events in the body. Turns on and off chemical processes, sends different neurochemical flows through the nervous system. So our thinking is so important. One thought has the potential to make us feel a certain way. And if we're thinking negatively, we're going to start feeling negatively as well. So what do we need to do? We actually need to transform our thinking. We need to change our thinking. We need to change our thoughts, and we change our world. This is super important when it becomes the chronic pain, to breaking this pain cycle, is that we have to make a choice to move from negative thinking to positive thinking. And this starts with catching our negative thoughts, becoming mindful, becoming aware of when they pop into our minds, and not believing them. Because we know with chronic pain that there's nothing wrong with the body. The body has healed. Chronic pain is most of the time a problem in the brain and the nervous system. So we can know that what's coming up in our minds is just a pattern. It's like a bad habit. We don't like the pain. It creates negative thinking, which creates bad feelings, creates more pain. So we need to make a choice that we're not going to listen to our negative thoughts. We're instead going to put in some positive thoughts, positive thinking in the face of pain. I'm okay. My body's fine. All these things, because you actually are fine. There is nothing wrong. It's just a misfiring of the brain and nervous system. I'm not going to let pain run my life anymore. I'm in control. I can do this activity. I don't care what the pain does. We need to start thinking more positive, that we're actually okay, because this has a cascading effect in the opposite direction on the body. It sets off different chemical processes in the body that actually make us feel better. How we think translates into how we feel. So we want to shift from negative to positive thinking, and this will start to make us feel better. Now we know this is sort of the cycle here, that thoughts create our feelings, and our feelings create our behaviors, and our behaviors reinforce our thoughts. So this is the vicious loop that I'm referring to here. Today we're talking about the thought part of the cycle, which is one of the most important parts because it triggers off this cycle here. So if we can catch our thoughts early, we can stop the impending feelings that come in, the feelings of frustration, irritation, fear, hopelessness, the overwhelming feelings that come in response to pain. So if we catch our thoughts early and we change them to positive thoughts, we actually start to feel different. And then our behaviors and our feelings both, these are the two other components of our chronic pain treatment program. All three of these things, thoughts, feelings, and behaviors, we're going to break them down. So today I gave you a little taste of the thought processes, but if you look at the Pain PT, my YouTube channel, you'll see other information about our feelings and emotions and what we do with them, and also our behaviors and our actions. All three of the things are really important in overcoming chronic pain. Hope you enjoy this. If you liked it, please give me a thumbs up on YouTube, and I'll talk to you soon. Bye-bye.